Well, again, as I think was presented earlier in Mr. Woolsey's testimony, child care is available to all the families in stage one who needed to participate. So fundamental availability is there. I think there's this question about connection to different child care selection. What will parents choose? And parental choice is important, but our working assumption is that the greater barriers the family faces to success, the greater, the less educational attainment by the parents, the less likely they're reading to the child, the less likely they're prioritizing potentially child care, and would even have the ability to figure out, well, what is the best center-based option in my area? Through intensive case management and engaging with these parents, we think we can better connect the families who could benefit the most to quality child care.
And has the department identified counties that they would be interested in having participate in the pilot?
We have been speaking with various counties, and because the proposal is not approved yet, we've not developed yet what would be essentially the request for proposal to the counties, but several counties have expressed interest. We're really hoping we'll have a broad spectrum of counties, small and large, putting forward quality proposals.
So when you identify the counties, how will you ask for participation? Will this be publicized to all the counties?
Yes.
But tell me the process
Sure.
of that.
What we're hoping to do is work with other stakeholders, including Department of Education, First Five, alternative payment providers, other experts in the field to work on essentially selection criteria and what would be, essentially work on our, it's not technically a request for proposal, but it would look just like one in that we'd be working intergovernmental with our counties. We would work with them to develop that, basically for the counties to show us how they would use these resources to develop a pilot, to develop a program, modeled on the Chicago Child Parent Center, how they would fit that to what's happening in their county with these resources. And we would hope through the greater stakeholder group to have them, again, be involved in helping us think about what would be a good proposal and potentially having them be involved in the selection process.
Okay, and Mr. Woolsey spoke to this. Can you help us understand what components of the pilot project's parental case management are different from the intensive case management, which is otherwise offered under the family stabilization?
Essentially, they're really just two different focuses. The family stabilization program, we're really excited about that. That's essentially a recognition that families, when they come into CalWORKs, they have a lot of things in common in the sense that traditionally, if you look, the majority of them, you might find, even though this isn't the time they're coming in, they were a teen parent at one point. There's certainly an income situation going on. But what often actually brings the client in that moment is crisis. It's a familial relationship that may have changed. Housing may have been destabilized, perhaps even a brush with the child welfare system. What we see the family stabilization component is essentially helping to identify and work through those crisis situations, identify them, and help the parent who we think otherwise probably can succeed. So I think maybe Mr. Woolsey mentioned, the CalWORKs program has a series of participation exemptions. If a client, say, is caring for a disabled relative or has a very young child, there are reasons why folks can't participate, or a temporary disability. Again, what we're focusing on, if you don't qualify for one of those exemptions, though, exemptions from participation, we see that some parents are facing a crisis, like in housing, and we want to resolve that in a few months before bringing them into the Welfare to Work program. That's the focus of family stabilization. This proposal looks at folks who really just haven't been able to succeed. They've already fallen into sanctioned status, will be the majority of them, although there'll be others who are perhaps, we won't see a record of success, we won't see earnings, we won't see success in school yet, but we aren't seeing progress. And we're seeing that they probably fall into what we call the conciliation process. That's what we do before you're sanctioned. So from that group, we want to provide an array. We want to intensively case manage. We want to give them, really show them through the parental involvement piece, with the children in the classroom, the value of that education, the value of that involvement, which we hope leads to reading to the children at night and other things, but also, as I mentioned earlier, that ability to use that core hours to now build with additional hours to get to 20, to cure that sanction, bring in more money, that sense of success, which then we hope further builds upon itself. We would just say that the two systems are complementary. They're not exclusive. And we're hoping to resource it right. We want good proposals from our counties.
Okay. Then I have another question about the $335 per month additional qualified money to pay for additional qualified staff in centers that the administration speaks to. That supposedly will be providing service for parents, and I just was interested in what sort of additional training will this center staff receive prior to enrolling parents and their children, and also will the newly hired staff positions focus specifically on engaging the parents or also provide services to the children?
You know, that's a level of detail that, in fact, some of that will come out in the county proposals. Again, we wanted to resource this correctly. Our thought is we didn't just want to blithely assume that counties could immediately find child care centers, quality child care centers, that were immediately ready with no additional funding to basically add a parental involvement component to what they're doing. We wanted to resource that correctly, and that's what we think we've done.
So you will use the money for current staff, you're saying? Maybe
again, I think we would be looking to the county proposals. Counties, I could imagine different situations. I could imagine a county saying, working with providers where they said, hey, we don't really have this yet, but we're really excited about it. We want to be in your application. That county might indeed need some additional, that provider might need some additional hiring and might need some additional training. For others, it might be, hey, that's already what we do. We would just be expanding, so we would only need a little bit for staff. So again, I think that's another reason why we're rolling it out this way. We're hoping to build on it, but by allowing county flexibility and to see what they can do in their proposals, we want to enrich the proposal through their ideas.
Okay. And then the following questions deal with what sort of obligations the parents may have. In addition to trust line and tuberculosis testing, what other screenings will parents need to fulfill before entering a child care center?
We're not really seeing additional requirements placed on the parents. However, if a county welfare department becomes aware of an arrest or conviction that would otherwise disqualify them from trust line, such parents, we would not have them participate in this program.
So parents would be denied if they've had an arrest or conviction record. They wouldn't be able to participate in the program.
If they had a conviction that would otherwise disqualify them via trust line, then they would not be able to.
Okay. So the trailer bill also states that a county must use a standardized tool to measure a participating child's cognitive, emotional, and social skill development. Is this a standardized tool that's currently in use? And if not, will you be developing that?
There are lots of different tools currently in use for measuring. We would be working with the counties and with CDE and stakeholders to identify what might be best. Again, I think it would come out through that competitive process and through that stakeholder process. We haven't identified the one perfect one yet.
Okay. I realize it's a little bit of a work in progress. The trailer bill also authorizes a county that's participating in the pilot to disenroll a child. Can you please explain what that process would entail?
Again, I think the trailer bill is contemplating all possibilities. What we're really hoping for is to have a successful engagement with the parents, and through intensive case management, parental involvement, curing sanctions, all of those things we think speak to success and the likely success of the pilot. However, if first, and there's a second level, the way we've designed this is even if the parent, say, doesn't want to participate, But they did see, and they're not hearing their sanction, and that isn't working well, but they do see the value in bringing their child to this enriched environment, to this center, to the friends the child's made, to the learning that the child is doing. And they would bring them. We would hope that would continue. However, we put it in the trailer bill. We wanted to contemplate the world where the parent not only didn't succeed themselves, but they essentially gave up on bringing the child to the center. After a certain amount of time, we just want to be able to reuse the resource. We would like to be able to rechannel that back to potentially another family that could benefit from it. But again, that's really all the trailer bill is getting at, not a dire desire to cut this off at some point, just the ability to redirect the resources if ultimately the family's just not taking advantage of it.
Okay. And I have a few more questions. Yes, please, go ahead. Senator
Just to follow up to that, so whose decision is it? Again, you don't want to disenroll children, but it is provided the power to do so. Is that by the provider, by the county, by the state? Who makes the decision to disenroll, and what rights do the parents have if they object to the disenrollment?
Well, again, we're really only talking about disenrolling when the parents have essentially made the decision not to bring the child. If the parents are bringing the child with any sort of regularity, this wouldn't be what we'd be discussing. Back to who would make the decision about that lack of attendance or not having. I mean, I would imagine that the provider would essentially tell the county, well, this family, they participated well for the first 2 months, but then the parents stopped coming, and for the last X time, the children have stopped coming. After that discussion, I would think the county would be allowed to okay that. We haven't gone into the detail of whether they would need to seek our clearance first. We could work that out with the stakeholder group, but I would imagine it would be an observation by the child care center that this family is just not participating and benefiting from it, and sort of concurrence by the county that indeed that is the case, and it might be time to redirect the resource.
And of course, all services operated through our department have rights of fair hearing. So if despite the apparent intuitive logic of if the parent has essentially disenrolled their child, it would sort of flow that then the county would disenroll the child. But if the parent felt that that was inaccurate information or was mischaracterization, they have appeal rights and fair hearing.
So there's no right to disenroll built into this proposal for behavior of the child, some type of concern about health of the child or anything like that?
I would think we'd be following sort of standard rules. Children that have a health condition that would make it unsafe for them to be there.
What standard rules are those?
And I'm not on the licensing side. I'm treading off into that slightly different
area. In terms of child conduct, we're not anticipating disenrolling because of disruptive conduct by a child?
I think we have to start from the assumption that the provider and the county case manager are going to be working closely together to try to help resolve issues. In the extraordinary event that a 3-year-old's behavior was so extraordinarily uncontrolled, then I think from a county perspective, the next step in that process is not try to disenroll the child. The next step is to try to link the child to whatever resources that whole county network can bring to bear to resolve issues. And whether these issues are playing out as a result of conditions in the home, or whether it's a historical fact, or whether it's a medical fact, my sense is once we are in connection with that family, we own what comes next. And it's just, if it can't be usable and useful as a learning environment to be in the child care center, then we have to make whatever arrangements are necessary for the well-being of the child.
Okay.
Senator Monning has a question.
I think you kind of along these lines of just situations for disenrollment. We're going to hear shortly from the education side of this, but I think there might be a nexus on some truancy issues for old elementary school age children, where we have really a crisis in certain counties in California. 2 of them are counties that I represent with high truancy rates among elementary school children. And while there are criminal pathways available to prosecute parents, the growing objective with truancy problems is to do more of an intervention to try to figure out what's going on, what types of resources might be helpful. I would think there might be an intersection between truant child at school and not showing up for organized child care. Anything in your plan or in the pilot programs that would also build in communication with educational system or, if necessary, district attorney's office, again with the goal of constructive, helpful intervention, not necessarily accessing the criminal justice system.
When the concept and the proposal was being developed through the administrative budget process, we had not yet gone to that dimension of it. Subsequently, Western Center on Law and Poverty is sort of raised with us what is the potential function of the CalWORKS program in averting early education truancy. So that's something which I consider a live issue that we have to move forward on. It's certainly an issue that both the Blue Ribbon Commission on Children in Care and others have started to address. The Attorney General has been addressing. We've been looking at some models actually from the city of Baltimore, where the social services agency has been able to partner with local education focused on early grades to work with families, not in a this is the child welfare system coming to the door sort of mode, but rather, is there a problem-solving system we can put together here? And it has apparently built a very effective partnership on both ends, where when things have moved to being a potentially child welfare involvement, the education system has been closer to it then and been able to be an effective partner in helping identify alternative caregivers, people who are sort of identified on the emergency contact list.
Good.
Known.
Yeah, and I just appreciate that it's on the radar, because often we have silos of the education system trying to deal with truancy issues, and there could be a very logical nexus of some of the safety net support. So thank you.
I would just add that, again, that's part of our thinking here. You talked, Senator Monning, about sort of intervening earlier, so we aren't talking about criminal truancy. I think the idea is through the parental involvement, through the intensive case management, through that offer of child care, even if the parent isn't succeeding, we're building that habit of, getting my child to the child care center is an important part of what I'm doing, and we hope that carries forward into school.
So I have a couple more questions, and the next one is, if the department terminates any of the projects within the pilot, will another county be able to apply for the pilot to take the place?
Again, I think we're talking about a worst-case scenario here. We're hoping that we have many good applications and counties operating the program successfully. In the event we saw one that wasn't working.
But you'll probably have the other counties that would like to be part of the program. That's my point.
Exactly, ma'am. What I would say is that's why we put that into the trailer bill. We wanted that ability that if a county isn't succeeding and we have resourced them to be part of the pilot, timing appropriate, we would say, well, maybe we want to have another county be operating it, indeed, because we're dealing with limited funding. That was why we wrote that into the trailer bill. In terms of what would happen to the children participating, we would need to work out a transition plan before we
So you anticipate doing that?
We would certainly have a transition plan. I'm hoping we don't have to terminate any county. We have more quality proposals than we have resources. Those quality proposals are then turned into quality programs, and we wouldn't be making this judgment. But we wanted to give the ability to do it and the ability, as you point out, to redirect those resources if necessary.
Okay. And then the last question is, since you are proposing a pilot program, when would you say that you would have the comprehensive final report to share so we can figure out where to go?
Yes, we are proposing to have this, independently evaluated, and we've built that into the budget. And, in terms of a final report from an independent evaluator that we would contract with, that will come several years from now, probably around 2018. However, before then, we would probably be getting interim reports that we would share in a stakeholder format with the legislators and legislative staff. Moreover, we would be looking at administrative data along the way. Are we curing those sanctions? are families making transitions that have been in this pilot into either employment or school? What are the numbers? In other words, there's administrative data that I think would be very, very revealing that we don't have to wait for a final report on. And we would, of course, want to share that through a stakeholder process.
Okay, thank you. And I would just say that the legislature would be very interested in making sure that we did have the reports so we can, determine how this is moving forward. We like to have timely reports, and we probably like to have very specific dates when the reports would be ready. So thank you very much for that. LAO, any additional comments? Department of Finance? Members, any additional questions before we move on to public comments? Public comments, please. Come forward. We're going to try to keep our public comments to a minute each, please. Yes. And these are public comments on the item we have just been speaking of. Department of... Oh. All right. Anybody here to speak on the Department of Social Services Parent-Child Engagement Pilot Project? Thank you.
Hi, Janine Micheletti, representing the California Alternative Payment Program Association. Our members are public and private nonprofits that connect our working poor families with childcare. I had a couple comments in regards to this, as well as the presentation earlier by Dr. Cannon. I appreciated Dr. Cannon speaking about the stability needed for children. But I'm struggling this year in our legislative session when we're talking so much about stabilizing the child, but the child can't be stabilized without the family. And we've got to look at all of the poverty stressors that our families are facing if we really want to make an impact in the lives of these children and to connect them to quality environments. Earlier, you raised a question of what could we do to stabilize moving forward? I think that we need to reinvest and stabilize what we've decimated the last couple years. We've shuttered our highest quality Title V centers, yet we have a pilot program here that we want to get the families engaged in our Title V centers. We just don't make sense. We need to bring the rates up. We need to stabilize the centers. We need to provide, we need to pay providers what they're worth. And I would like to just sort of echo and keep my remarks very brief. I'd like to echo the remarks by the ledge analysts on concerns on the pilot program before you. I think that it has merits, but with all the cuts that have taken place, I think rather than $9.9 million go to this pilot program, I'd like to follow up with what Senator Corbett and Senator Block.
We're almost to 2 minutes.
Okay.
So
put the money back into reestablishing the centralized eligibility list for $7 to $8 million instead of $9.9 million in this new project. Thank you.
Thank you very much.
Good afternoon. Welcome. Good afternoon. My name is Patricia Smith, and I'm a site director at EES's Jeff and Denise Jacobs Child Development Center in San Diego. It's a nonprofit child development agency that educates over 1,100 students per year at 22 of our Title V preschools in San Diego County. And we serve children ages 18 months to 5 years of age. And Chairman Block, thank you so much for coming to visit our full-day year-round program in Linda Vista last month. Really appreciate that. The most cost-effective and efficient way to increase access to high-quality early education is by reinvesting and restoring funding to existing evidence-based quality early learning programs in the current mixed delivery system that serve children birth to 5. Instead of creating a new grade for elementary schools with exorbitant implementation and development cost, or dismantling and shutting down Title V programs as recommended by the LAO, California should restore and reinvest in the current evidence-based system and its dedicated yet underfunded early childhood workforce, a workforce that includes myself. I'm reaching out to you on behalf of the fellow 150 teachers, and on behalf of the 1,100 students, and on behalf of their families, and on behalf of the hundreds of families on our waiting list, and on behalf of the thousands of other families who do not have access to high-quality educational programs because of severe program underfunding. You have the opportunity to invest additional critical resources, where the return on the dollar is the highest, which is our youngest children. Thank you for listening.
Thank you very much. All right, I am going to indicate when we get to 1 minute, just so you know. Thank you.
Good afternoon. My name is Anna Levine. I'm senior staff attorney at the Child Care Law Center, and I want to thank you for your work on these important issues. On the pilot project, I think that we would just like to stress that we'd like to see the highest value for money across the widest group of children and families. And so our thoughts on the pilot program are that there are ways that are potentially lower cost to engage families in the child care setting, such as through legislation to allow parents to participate in the child care setting and have it count towards welfare to work activities. And there are ways that have been mentioned before to build up the quality of our child care programs that parents and families are engaged in. And particularly, we'd like to see for CalWORKs families and for young children, the family child care homes and the standards there, not just in the Title V centers built up, because many children can't access, many families can't use the centers, and CalWORKs families, because of their variable work schedules and other barriers. So that's critical. And the last point is that there are a lot of quality improvement efforts out there. And in particular, at the federal level, the new Child Care Development Block Grant, Child Care Development Fund rules, which are coming down and which we are going to have to comply with over the next couple of years to maintain that source of 40% of our child care funding, have health standards and early Head Start as well. And so we'd like to see all the programs that the parents are engaging in brought up towards those standards rather than targeted dollars just in a few places. Thank you.
Thank you very much for your testimony.
Hello, thank you for the opportunity. My name is Mark Moxkey. I'm the Executive Director of Kids Club Preschool in Antioch, California, Title V Center, serving CalWORKs parents as well. I would like to speak of a common preschool mentality. In preschool, we always try to focus on the positive and enhance the positive, and that will bring up some of the struggling areas. I'd like to speak a little bit about your questions about what does quality preschool look like and what are the short-term goals. The Perry Preschool Study by the High Scope Education Foundation is the longest longitudinal study, and I'd come here before you to give you a beautiful opportunity. I am one of 2 trained high scope trainers in the state of California. The other one is my mother. We currently operate the only high scope demonstration school in the state of California, 300 children large. We are 1 hour away. I would love for you to come and see what those standards looks like when they are applied. We can speak about the short-term goals.
1 minute.
Thank you for your time. I will mail invitations out on Monday, and I hope that you will have an opportunity to come and see it firsthand within a Title V center. Thank you for your time.
Thank you for your invitation. Thank you.
Good morning. My name is Mary Ignatius. I'm the statewide organizer for Parent Voices. I agree that this parent-child engagement pilot has a lot of merit to it, but I'm also concerned about the cost and the small amount of children that could benefit from it. It does feel like some of these things can happen on the front end. And when the CalWORKs program has been decimated, as it has over the last 5 years, before a parent came to CalWORKs and had a support team. There was an employment specialist, there was a child care specialist, there was someone helping to get transportation and food stamps, just a kind of a holistic approach to helping a family. Today, a parent can call the office and go into an answering service, and any one person can call them back. And that's just because of what's happened when we've taken so much funding out. And so if we could put more funding back in to serve all families across the state and bring back what a support team could look like to help stabilize families. Again, families coming through the CalWORKs system have access to stage 1 child care. They can choose the best child care that fits their family's needs. What I believe children need for stability is continuity of care and being able to stay in a child care program for 1 year without the ins and out because of reports or because of what have you. State preschool allows for 1 year eligibility, and that kind of thing can also provide stability for the child and stability for the family. And I'll echo what Anna Levine said from Child Care Law Center. What would it take to allow volunteering in a child care program to count towards your welfare to work activity across the state? We'd like to see that as well. Thank you.
Thank you.